The U.S. government response to Zika right now is really operating on a shoestring. The administration has taken funds from other places so that we have some funding available to respond right now. But the $1.9 billion request that the President requested is really critical to be able to respond effectively. And some of the interventions are really quite expensive, the vector control activities in particular, but really the whole breadth of work from diagnostic testing to communication with people who might be at risk, to really clarify what those risks are, to tell people what we know, and especially as things change, keep people up to date on what the information is. There are scientific questions that really won't get answered unless we have the funding, and we really won't be able to protect the American people to the extent that we can from the technology standpoint without that funding. The issue that I mentioned for current funding is really identifying funds from within the current budgets to be allocated to respond to Zika. Within CDC, there have been substantial cuts in programs. One of the ones that I'm responsible for is for the preparedness work that states do, that has been cut 8% as part of the effort to respond to Zika. So there are things that states need to do to stay prepared for other threats that they won't be able to do unless there is funding for Zika.